Okay, well, thank you. So we're switching to our second presentation, and hopefully everyone can stay, but I know that we have lots of commitments. So I'm going to now introduce our second presenter, who is Bhavya Joshi, who is going to be presenting on sexual and reproductive health in emergency settings. Bhavya spent the summer in Croatia researching unmet reproductive health needs of Ukrainian refugees. She's also a second-year DrPH student with over 7 years of experience implementing and evaluating public health projects in South Asia. She received her Master's of International Law and Human Rights and has a bachelor's degree in political science. And so, Bhavya, you're going to share your slides, so I will let you start that. And again, I can monitor the chat, but I think we'll save question and answer till the end.
Thank you so much, Karen. I'm going to start. Can you see my screen now?
We can. Yep, we just need to go on. There we go. Perfect.
Perfect. All right. Thank you. Thank you so much, Karen, for that warm introduction. Hi, and good afternoon, everyone. Thank you so much for joining today. And congratulations to Renee for such an incredible presentation. My name is Bhavya Joshi, and I'm a second-year Doctor of Public Health student. And as Karen mentioned, I spent the summer in Croatia researching the unmet reproductive health needs of Ukrainian women refugees. I was also actively engaged in reproductive rights and justice work through advocacy, and I work primarily on 2 projects. One involved using international human rights mechanisms to advocate for abortion rights in Croatia, and the other included creating education programs for women human rights advocates in Sudan. And in today's presentation, I will touch on the key learnings from all these 3 projects. The first part of my presentation will focus on the field visits, where I provide an overview of the context I worked in, the methodology we used, the journey of a refugee, particularly Ukrainian refugees in this context, and what were their reproductive health and needs, or what were their reproductive health needs, and what are some of the challenges they faced. And the second part of my presentation will focus on the 2 advocacy projects I mentioned. So we dive into the background. So due to the Ukrainian invasion of Ukraine, more than 7.5 million Ukrainian refugees have fled to neighboring countries since 24th February 2022. Of those who have fled the country, 90% of them are women and children, since men between the age of 18 to 60 years are required to fight in the war. So they stay back in Ukraine. So it has been called a women and child humanitarian crisis. Most of the refugees have arrived in Poland, Romania, Russia, Hungary, Moldova, Slovakia, and Belarus. And Croatia, along with other non-bordering Ukrainian countries, has also been receiving Ukrainian refugees. So until now, the statistics are that there have been about 22,000 displaced persons from Ukraine that have entered Croatia. 86% of them are women and children, and this is Croatia's statistics. And about over 20,000 of them are living in individual accommodations. And I'll get to that in a second, what these accommodations are and what are the different kinds of accommodations where refugees are housed. But before that, I just wanted to quickly go through Croatia's political stand on refugee crisis. And I think this is kind of important in understanding how they are responding to the crisis. So Ukraine and Croatia had signed an agreement on friendship and cooperation on 24th October 2002, which entered into force in August 2003. And in that, they came recognizing the political history, which is based that Croatia and Ukraine were one of the first states that recognized each other's independence in 1991. So Croatia, which was part of former Yugoslavia, and Ukraine, which was part of USSR, were fighting for their independence, and they recognized each other's independence first. And given that political history, the Croatian parliament issued a declaration on Ukraine. And the parliament in this declaration asked the states to fully support the Ukrainian people and provide them with all the necessary humanitarian and technical assistance. The Croatian government prefers using the terminology displaced persons from Ukraine rather than refugees, but you'll see all the humanitarian organizations using refugees as a term. So you'll find literature which uses both terminologies, but I will be for this presentation also using it interchangeably. So the clause 2 of the declaration basically reads that the Croatian parliament will fully provide support to Ukraine and recognize international borders. And in summary, what has happened as an impact of this is that Ukrainian refugees have been warmly welcomed in Croatia. They have been given access to healthcare services like any other Croatian has access to healthcare services. And the integration response has been unlike any other response in the past with refugees from countries like Syria, Pakistan, Afghanistan, Sudan, and others. So the methodology that we used for the fieldwork this summer was basically interactions with a few humanitarian organizations, including the Red Cross Croatia, ADRA, Solidarna, the Ukrainian Committee, and Doctors of the World. We also interacted with the Ombudsperson Office on Gender Equality in Croatia and had them involved in some of the processes that we followed while working on field. We also did some observation visits to collective accommodations in Korenica and Zagreb. One is a city-based accommodation, and the other one is in rural areas. We also had a few interactions with healthcare providers, Red Cross volunteers, and social workers. There was a desk review involved, and the findings and insights in these presentations are going to be based on these interactions that we had. Now I'll dive deeper into the journey of a Ukrainian refugee. So the first reception process works in about 5 stages. The first stage is entry, which is where any Ukrainian seeking temporary protection can enter Croatia using any border. And they have 5 most common ports of entry, which are, a couple of them are through land and the rest are through sea. The second part of the journey is really that they have to declare their status as a displaced Ukrainian person, and they have to declare any minor that they are traveling with, or any kinship or any relationships that they have with anyone in Croatia. The third is they have to go through the border police checks, where basic documentation is reviewed, and the police shares pamphlets and information about future processes and other documentation that needs to be done. There's no travel ID required. And this is basically recognizing that a lot of people had to leave Ukraine in very severe circumstances, and they might not have grabbed their passport or travel IDs while leaving. And so this is a leeway which has been given at the border, which is being reported that is pretty different from how it has been done with other refugees in the past that have come from Syria and other countries. And in addition to this, if there is a group that arrives, police typically takes them to a special check space, which is like the railway station in the locality or something, and they go through the process there for the groups. And social services is typically involved in case of any unaccompanied minors that come in with groups or individually. So border control is really where it takes most time, and is a very thorough process that happens with checks. The fourth part of the journey is accommodation. So after the border checks are done, they are sent to reception centers or allowed to continue the journey with their friends or family, or if they have a private property in Croatia, then they're asked to move there. And in the end, there are transfers. So basically, the first point of entry is a reception center. After that, they are sent to either an individual accommodation or a collective accommodation. And in case of individual accommodation, they are asked to stay in touch with the border police. And in terms of collective accommodations, they are just, the government basically monitors those accommodations, so they remain in record. And once the refugees are done with all the paperwork, they're required to complete 280 hours of Croatian language course and fulfill other immigration requirements. and visit hospitals, schools, local institutions to fully integrate into the system. So here are the three types of accommodations. The reception is basically a short-term government stay, which is up to 48 hours. It's basically to ensure that there's a space for secured sleep, nutrition, internet, psychosocial, and health support. And there are three such centers in all of Croatia. After that, they are typically moved to a more permanent setting, which is a collective accommodation or an individual accommodation. And the reception center is typically managed by Red Cross and the Civil Protection Office, along with a few police and health workers. The collective accommodation is really when they're moved from reception to the second point. Here, the idea of this is to provide a long-term accommodation, food, and basic internet services. And the hotel employees basically cater. So most of the collective accommodations in Croatia are hotels, and that's why the hotel employees cater to any issues that the refugees might face. They also have a couple of government employees at these accommodation centers who visit once in a while to coordinate if there are any needs. And there are 37 such accommodation centers across Croatia, of which I visited 2 of them, as I mentioned earlier. And the individual accommodation primarily is with Croatian citizens, relatives, friends, acquaintances, or if they have their own properties, then they can go there. But if they don't, a lot of times if a family of 4 comes, then a citizen who might have volunteered to put their house or an Airbnb or anything, they would have kind of formed a consortium with the government and the agencies that are involved in supporting the refugees, and they in that contract they would then provide these services or give their accommodations to the refugees. So yeah, here's the a broad overview. So since 25th February, the Croatian Directorate of Civil Protection has mobilized about 40 facilities for the disposal of displaced persons. As I mentioned, 3 and 37 accommodations. The details of the number of people in those accommodations currently is also listed. So there's nobody at the moment in the reception center because, of course, there's a huge dip in the refugees coming in to Croatia. Most of them are in individual accommodations and about 1,500 of them in collective accommodation. And the number of people who've entered Croatia till now is about 22,000. And this is the division based on women, children, and men. And then there's one additional company that supports with food preparation and delivery and laundry and transportation and all of that. There's unfortunately no exit statistics yet that has been published. So with that overview, we'll now move into understanding what are the reproductive health needs. So in total, there were about 5 to 7 pregnant women in collective accommodations when I had visited earlier this summer. And after integration into the system, they all typically get full health coverage like any other Croatian citizen does. And this includes chronic and acute conditions. All services are provided free of cost, including gynecological services and child delivery. The gynecologist typically visits the centers once every week. And in case of any emergency, they can always go to a nearby health facility. And at the border, when they arrive, unfortunately, reproductive health services are not provided and it's not considered a priority. So any emergencies in that space becomes a huge challenge. And with that note, I'll dive deeper into the challenges that we identified while working on this topic. The first 2 are related to service delivery. So when I interacted with the humanitarian workers, one of them mentioned that they were not providing sanitary napkins in the emergency relief kits. And after a few days, someone got a box and placed it in the relief resource room, and it literally took 10 minutes for the box to get emptied. And that was pretty shocking for me because most of the guidelines suggest that you should have basic menstrual hygiene products in relief kits, but unfortunately in the places that I visited, that was not being delivered. So I basically asked, we are calling this a women and child crisis, and why did we not think that nearly half of the population could be menstruating at the moment? And the response I got was that this was not our priority, which was really shocking to me. And they said that they asked about the needs. So basically, these humanitarian organizations interact with the refugees and ask them what are their needs. And when they asked them, nobody told that they need sanitary napkins because of the taboos associated with it. So there was this huge gap in communication, which the humanitarian agencies did not factor in and did not provide sanitary napkins for the first week, 10 days, after which it was kind of included in the relief kits. The second part was around inequalities. And like I mentioned, in a conversation with another organization, it was noted that refugees that had entered Croatia in the past do not necessarily receive similar treatment with respect to their health services, particularly reproductive health services, and their benefits are comparatively limited, and their integration into Croatian society hasn't been very smooth due to language or cultural barriers. The next set of challenges are more related with access. So the cost of transportation was a big issue because they are not provided with free transportation. So the Ukrainian refugees have to incur the cost themselves. And the nurse at the Zagreb collective accommodation recognized that the public transportation to the nearby health facility is not very well connected. Hence, it created an impediment for women and children to access regular health services, especially at odd times or in case of emergencies. It was a huge challenge. The first aid kind of point at the hotels and the accommodations is very basic. So you cannot get extensive reproductive health services there. So you have to go to a doctor, especially if it's not the day of the visit of the gynecologist. And sometimes, I mean, on paper, they are supposed to visit every week, but sometimes we've noted that they wouldn't come for 2 weeks. And so that kind of creates more challenges. And then the other was different healthcare practices. So Ukrainians as a culture rely more on homeopathy, and they have a concept of getting countertop medications, which is not the case in Croatia. So it was a huge challenge for them to understand the system and then to go get the prescription to be able to access basic drugs that they needed. And in rural Croatia, accessing health services obviously was even more challenging, and doctors were inaccessible many a times. Some of the other challenges that we noted was, one was there was no central point of communication. So there was no one center help desk that answers all the needs of Ukrainian displaced persons. Every department has its own helpline, and Ukrainian organizations in Croatia are typically responsible for the translations. And according to them, in hospitals, the issue with translation is still not resolved. So at the primary health center, which is kind of at the accommodation center, and like I said, it's literally a first aid center is what they call it. And there they can still use, Google Translates or something. But when you have like 10 minutes with a doctor, you have to explain everything, you are a part of the health system. It's much more challenging for them to communicate. And that is a big gap still. And the other point was around changing health workers. Every day, a new medical staff member provides health services. So follow-up is really difficult. So these health workers have their full-time medical jobs, and they come in as volunteers to these health centers. And so every day there is a new volunteer who comes in, because for the rest of the days, they are working in the hospital as a part of their regular job. And so if a woman accessed, say, reproductive health services today, or needed some basic help with any sort of medical, or health services, she had to come again next day and explain the same issue, particularly if it was not well documented, which would happen very often because of the load. She had to come again and explain the whole issue. And that was a huge gap, because the Ukrainian refugees felt that language was a barrier, and it was difficult to communicate the same problem every day to a new provider. Sorry, my cursor's acting up. So I'm just trying to get it back on the screen. All right, it's here. All right, so in conclusion, programs were, it was noted that programs for displaced Ukrainian persons were initially mismanaged, but over time they kept getting organized in design and implementation. But challenges kept evolving. So in the beginning, it was a lot to do with managing the load and documentation and all of those challenges, then setting up the health facilities and different accommodations, getting providers to be present for a certain number of hours every day, translation. Those were some of the challenges that were incurred earlier. But towards the end of my work this summer, these challenges evolved towards that evolved and were related more to do with or were to do with integration. So like going to schools, going to hospitals, getting registered in the health system so that they can access the service regularly, how to engage more often in community projects. So like those sort of challenges started surfacing. But some of the areas of improvement that we noted were prioritizing reproductive health services at border and in emergency response, which I shared the story about, like it was not necessarily being provided. Secondly, was improving access to health services, especially in rural areas, and ensuring that there is support for transportation. And third was providing centralized services to Ukrainian displaced persons. So just having a center point where they could call and contact and get in touch with the healthcare providers in case of any emergency or challenges they're facing. And so, yeah, in the end, I just kind of wanted to share a quote by a Ukrainian displaced woman who ended up being a volunteer at Red Cross and Civil Service Office. Yeah, and I think the crux really, I'll leave you to read it, but I think the crux really is that the Croatian government has made sincere efforts in welcoming, supporting, and integrating the Ukrainian displaced person. And this woman felt that the support in Croatia was much more than they experienced in other countries like Poland or Germany. All right, so the second part of my presentation focuses on advocacy, and I'll quickly review two projects. So the first is related to the abortion case in Croatia. So meet Mirela Kaveda. She's a 39-year-old Croatian woman who was denied access to legal abortion in Croatia this summer. Her case stirred sentiments of thousands of women across the country, and protests were organized in 9 cities. Mirela soon became symbolic to women's reproductive health struggles in Croatia. So in April 2022, Mirela was 6 months pregnant, and upon her regular gynecological examination in the 24th week, a very large, advanced, and rapidly growing brain tumor was detected in her fetus, endangering its life and potentially that of its bearer. The prognosis noted that the fetus had a very low chance of survival or normal life, and no doctor in Croatia agreed to terminate Mirela's pregnancy. Most of them refused on religious grounds. One claimed that abortion after the 10th week of pregnancy was illegal in Croatia. One could not confirm the diagnosis, while the other claimed that their health facility did not have the necessary infrastructure to perform the procedure. The tumor developed rapidly, and almost weeks after the first diagnosis and undergoing more than 7 examinations, Mirela was denied access to legal abortion in Croatia and had to undergo the procedure in Slovenia, which is a neighboring country to Croatia. And the cost was about 5,000 euros for the procedure alone, which was initially incurred by Mirela, and it amounted to about 5 to 6 average Croatian monthly salaries.
So yeah. Okay, sorry about that, Bhavya.
All right, thank you, no worries. Yeah, so I was just sharing Mirela's story and the fact that she had to incur all the costs for the termination of pregnancy, which amounted to about 5 to 6 average Croatian monthly salaries, which is like half of your annual income, which is crazy. Yeah, so the law on abortion actually in Croatia allows termination of pregnancy after 10th week, only if there are serious health threats to women or fetus. So one of the hospitals who denied access to abortion services based on the fact that it is not allowed in after 10th week was actually not relevant in this case because of the exception. And despite a legal plea, she was denied access to safe abortion services. So leveraging on this, on the pushback from the public, which I just showed you that there was a lot of rallies organized and a lot of people came out in her support. Leveraging on that pushback, DOSTA, which is a reproductive health consortium, submitted a communication to the United Nations Special Procedures. And I was fortunate to be the lead author of that submission. It was sent to the United Nations Special Procedure on Health, the Special Rapporteur on Violence Against Women, the Special Rapporteur on Torture, and the United Nations Working Group on Discrimination Against Women and Girls. And the report highlighted the human rights violations of right to life of a fetus bearer and right to health, including reproductive health and rights to a family of a woman and right to a family and child. The consortium also is making continued efforts to hold the state of Croatia accountable in the United Nations treaty body system, which you see on the right side of the slide, but is not highlighted because for this project, we focused mostly on the Special Procedures, which is a charter-based human rights body and falls under the Human Rights Council at the United Nations. But the consortium is making continued efforts to hold the government of Croatia accountable at the treaty bodies. And also, they are planning on going to the Universal Periodic Review of Croatia, which is next year, to the Committee on the Elimination of All Forms of Discrimination Against Women, as we call it, CEDAW. So you can see on this slide, the Universal Periodic Review is also a charter-based body process. Right. So here's a review of the submission and the public interviews, press releases that we did. We made a press release on the World Safe Abortion Day. And these were some of the activities that we kind of did to support Marilla and her case. And as an outcome, there were remunerations that were made by the government to Marilla. About 100,000 euros were raised for her cause. And of course, she was remunerated for the process, but there was also a budget created for future such cases. And there was a lot of space and a platform that was created for many other women facing similar challenges to access safe abortion in Croatia. And my second advocacy project was to develop training modules for women human rights advocates and activists in Sudan. The Sudan government expressed interest in ratifying the CEDAW Convention, which I just mentioned is the Convention on the Elimination of All Forms of Discrimination Against Women, which initiated this project and to work with women organizations there. So there are 3 governments currently, including the United States, and then a couple of islands that have not ratified this Women's Rights Convention at the UN. And what that means is they cannot be held accountable for any women's rights violations at the UN. So Sudan, which was one of the 3, has now expressed interest in ratifying and holding itself accountable in the United Nations space for violating women's rights, which is a great step and a progress that has been made because this convention has been on since 1980s. And so it took almost 40 years or so, over 40 years or so for some of the countries to come around. So the project is currently ongoing. It started in September and it will go on till December. We've developed 6 modules to cater to about 25 participants from Sudan, and they are from grassroots organizations, they are from women-led organizations. Some of them are individual human rights activists and advocates. And so we have an interesting mixed group, and the aim is really to strengthen their capacities to use international human rights mechanisms for women's rights advocacy in their country. In the process, we've also faced a lot of challenges, including that there's been a coup in Sudan for a couple of years now, which has really pushed the timeline for this project a few times. So this is the 3rd time that we proposed this timeline is finally working on. The internet connectivity is unfortunately a major challenge. We face because most of the people are unable to log in and review the content in time for us to release the next module. So we had to really change the format and adapt very quickly. So a lot of our lessons now focus on, it can be opened, for example, on an iPad or a phone, and we are giving access through of these modules to different technological devices, I guess. Yeah, and then there's also been challenges with respect to organizing live sessions because of crew issues or internet issues, and safety, of course, is a big challenge for these women. So we have to organize them in groups in safe spaces. So a lot of them travel to Khartoum, which is the capital, to be able to participate in these events. So there had to be workshops that had to be created in Khartoum that are then led from moderators from different parts of the world. And restructuring of the lessons, as I mentioned, and stakeholder management has also been a huge part. And before I end this presentation, I also thought I will quickly show you the modules that we did create for this program. So here's one of the modules which overlooks the principles of CEDAW, which is the committee. And so we try and make it as interactive as possible for our participants to engage, and we try to compress the information in through short videos, like 2 minutes, 3 minutes, or just through some of these interactive tools that we have in this platform. So, and then we do like these knowledge checks, which kind of gives you a feedback automatically. So yeah, I also wanted to show you quickly the outcome of that work. On that note, that's it from my end. Thank you so much for listening and showing up today. Really appreciate you coming in. Thank you.
Thank you so much, Bhavya. It's really incredible work that you did, and I so appreciate you sharing today. And I do apologize for the interruption. I think what happened was Renee got into the meeting before I did, and she might have claimed host, and she had to go to class, and potentially when she left, she accidentally ended meeting for all. So we will piece it together. But yeah, so I want to open up the floor to any questions that the remaining participants have. I think we lost a few people in that disruption, but for Bhavya. I can get started. I know it can be really challenging to spend your summer in a different place abroad, and like particularly you were working in refugee camps during a crisis, and so I think if maybe I'd be interested in knowing like a high and then a low that you had during your summer of being away.
I think I'll start with the low because it automatically strikes me because it was really glaring for me to see that despite, including sanitary napkins in relief response has been such a basic guideline for years now, and there are studies that have shown that that's kind of led to positive outcomes, but it was really sad for me to see that in 2022 we are not providing sanitary napkins as in the first response relief kit to a crisis that we are calling a women and child crisis. I think I was really blown off with that, and I think my high really was the fact that my partner organization in Croatia was just incredible in every form. And they were amazing with getting all the resources, organizing events. So in 2 months of time, we were able to do so much work because of how resourceful that organization was. And the fact that Mirilla's case was happening when I was there, and they got me on board and we could do the report in the timeline that I was there. We submitted it, we could do a few press releases, we interacted with the media. So I think that whole process in itself was amazing for me to see how, in case there is a pregnant woman who's obviously on a timeline because, she needs to abort the baby until a certain, the fetus, till a certain age or a certain time in her pregnancy, and the fact that it was done so quickly to make that happen was my high.
Mm-hmm. It's impressive. You're getting a lot of great comments in the chat. And I know
Thank you.
before Renee left, she had left one saying that she sees some areas for collaboration between the two of you. So I hope that you're able to connect after this, and everyone's just really impressed with the work that you're doing. So I guess, are there any, next question would be like, what's next? I know like you seem to have really created a space for yourself in this world. And so like what you're thinking, and I know you also have your own organization, correct? Yeah. So if you want to maybe speak about that for just a couple minutes, and then we can wrap up.
Yes, surely. So a lot of this work that I do with, so my focus area is like really at the intersection of reproductive health and human rights. So a lot of advocacy work that I do with the human rights mechanisms at the United Nations is through my organization. And some of these projects that I run are also it's my organization that works in the consortium with other organizations that helps us run these projects. So a lot of this advocacy work is through that. And moving forward, I think I'm doing my doctoral research in reproductive health, on reproductive health in times of emergency and crisis. And we're looking at still exploring a few locations, but I think doing more research in that space because it's needed. And there's very few papers and literature published on this topic in the last 2-3 decades since this topic has gained importance in limelight. And so I think there's a lot of space for more work to be done. Additionally, with my organization, I want to continue taking up more advocacy projects and work with governments that are willing to hold themselves accountable for women's rights violations, and also work with amazing and empowered women across the globe on how they can perhaps use another tool to do the incredible work that they're doing.
Wonderful. Well, thank you so much. And I look forward to following you as you continue this journey.
Thank you so much, Karen. Really appreciate it.
Were there any other questions, or I think we can wrap it up? Don't see anyone coming off mute. So thank you again, and thank you all for attending. And we look forward to, well, we should have more presentations coming up. But just if you're not already on the Bixby Center mailing list, please do email us at bixbycenter@berkeley.edu and get on that, please. Okay, thank you, everyone.
Thank you so much.
Stop the recording.